Perfect. I'll expand everything into a detailed, step-by-step drug study of methocarbamol, suitable for exams, clinical review, or nursing notes. Methocarbamol Complete Drug Study. Number 1, generic name, drug class, brand name, generic name, methocarbamol, drug class, centrally acting skeletal muscle relaxant, pharmacological class, carbamate derivative, schedule, prescription only, not controlled in most countries. Brand names worldwide, Robaxin, USA, Robaxin 750, Carbacot, Skillex, Robaxacet, combination with acetaminophen in some regions. 2. Definition. Methocarbamol is a centrally acting muscle relaxant used as an adjunct to rest, physical therapy, and other measures for the relief of acute painful musculoskeletal conditions. It reduces muscle spasms, but that does not directly affect the contractile mechanism of skeletal muscle. 3. Mechanism of action. Exact mechanism is not fully understood. Believed to act on the central nervous system, CNS, depresses polysynaptic reflex pathways in the spinal cord, produces generalized CNS depression, sedation, relaxation. It does not relax muscles directly like dantrolene does. May alter pain perception and reduce muscle hyperactivity. Number 4, uses. Symptomatic relief of musculoskeletal spasms caused by strains, sprains, and trauma, low back pain, whiplash, neck spasms, postoperative muscle pain, adjunct in tetanus management to control convulsions and spasms. On a 5, indications. FDA approved, acute painful musculoskeletal conditions, short-term use, adjunctive therapy in tetanus, off-label uses in some countries, muscle spasm associated with neurological disorders, spasticity, though not first line. 6. Contraindications, absolute, hypersensitivity to methocarbamol or any excipient, relative, use with caution in severe renal impairment, with IV form polyethylene glycol vehicle, hepatic impairment, drug metabolized in liver, seizure disorders, rarely lowers seizure threshold, myasthenia gravis, may worsen weakness. Number 7. Before taking this medicine, precautions. Medical history review before prescribing, seizures, epilepsy, liver or kidney disease, respiratory disorders, pregnancy, category C, use only if benefits outweigh risks. Breastfeeding, unknown if excreted in milk, use with caution. Alcohol and sedatives, strong additive CNS depression. Driving operating machinery, avoid as it causes sedation, dizziness, blurred vision. Lab tests may cause false positive urine tests for vanillyl mandelic acid VMA and 5-hydroxyindoleacetic acid 5A. 8. How to use, oral. Take with or without food. Swallow whole with water. IVIM, hospital use, administer slowly to avoid hypotension or thrombophlebitis. Should always be combined with rest, physical therapy, and other supportive measures. Short-term use only, 2 to 3 weeks, because musculoskeletal spasms are usually self-limiting. Nashner 9. Dosing information. Adults, initial dose, 1,500 milligrams PO every 6 hours for 48 to 72 hours. Maintenance dose, 4,000 to 4,500 milligrams per day in divided doses. Maximum, 6,000 milligrams per day, short-term. Up to 8 Gay has been used for severe cases. IVM, usually in hospital, 1 gram every 8 hours, up to 3 grams per day. For tetanus, 1 gram IV every 6 hours, may increase gradually up to 30 kilograms per day. Pediatric, musculoskeletal conditions, not well established for 16 years. Tetanus, IV, 15 kilogram dose every 6 hours. Mub10, misdose and overdose. Misdose, take as soon as remembered. Skip if near the next dose, do not double up. Overdose, symptoms, severe drowsiness, blurred vision, nausea, seizures, coma, respiratory depression, hypotension. Management, supportive airway protection, gastric lavage, IV fluids, activated charcoal, dialysis usually not effective. Number 11, stop or avoid taking. Stop immediately if severe allergic reaction, rash, swelling, difficulty breathing, severe drowsiness or mental confusion, jaundice, yellow skin eyes, indicating liver problems, seizures occur. Avoid alcohol, other sedatives, unless prescribed together under close monitoring. 12 side effects. Common, drowsiness, dizziness, lightheadedness, headache, confusion, blurred or double vision, eye redness, GI upset, nausea, vomiting, dyspepsia, metallic taste, serious, rare, seizures, bradycardia, hypotension, allergic reaction, rash, itching, anaphylaxis, jaundice, liver dysfunction, neutropenia or leukopenia, very rare, injection site reactions, pain, thrombophlebitis. Number 13, vital information, key nursing clinical notes. Short-term drug not intended for chronic muscle conditions. Does not cure cause, only relieves spasm pain. Monitor liver function, renal function, level of consciousness. Educate patient. Avoid alcohol sedatives. Do not drive or operate heavy machinery. Report yellow skin eyes, severe dizziness, fainting, or allergic symptoms immediately. Can mask pain, so underlying conditions should still be addressed. Number 14, drug interactions. Other drugs affecting methocarbamol. CNS depressants. Additive effects. Alcohol, opioids, benzodiazepines, barbiturates, antihistamines, sleeping pills, sedation, respiratory depression, anticholinergic drugs, e.g., atropine antihistamines, tricyclic antidepressants, risk of blurred vision, dry mouth, constipation, urinary retention. Pyridostigmine in myasthenia gravis, antagonistic effect worsens weakness. Other muscle relaxants, cyclobenzaprine, tizanidine, CNS depression risk. Warfarin, rare interaction, may increase INR. Monitor closely. Thank you. Have a nice day.